A very warm welcome and a good evening to everyone who is joining us on Facebook Live. My name is Gerald, a member of the University of Malaya Medical Society COVID-19 Task Force, and also the host for tonight's tea session. Tonight, I will be speaking to Associate Professor Nadia Atiya, who is a frontliner battling COVID-19 since early last year and has just received her first dose of the COVID-19 vaccine. You are most welcome to like, react, and share this live video out to your friends and family and get everyone on board to listen to first-hand experiences from our frontliner. To all viewers, you are most welcome to join us on Slido by scanning the QR code provided, or simply type in slido.com in your browser and type in the code 14972 and submit your responses according to the survey that will be presented during the session. The session will start shortly, so sit back, relax, and enjoy. A very warm welcome and good evening to everyone who is joining us on Facebook Live. My name is Gerald, a member of the University of Malaya Medical Society COVID-19 Task Force, and also the host for tonight's tea session. It has been almost a year since the World Health Organization declared the COVID-19 outbreak a global pandemic. Many lives were lost, the global economy stumbled, and many countries are struggling to contain the outbreak, including Malaysia. As of today, a total of 1,153 lives were lost in Malaysia, and globally, about 2.5 million deaths were recorded. While all may seem bleak, there's perhaps light at the end of the tunnel. With the vaccines being rolled out globally and as well as here in Malaysia, it is time for us to unite as one and fight the pandemic together. While the arrival of vaccines may not be the silver bullet to end the pandemic, it will definitely land a mighty blow to the wrath of COVID-19. Tonight, I will be speaking to Associate Professor Nadia Atiya, who is a frontliner battling COVID-19 since early last year and has just received her first dose of the COVID-19 vaccine. She is an Associate Professor of Medical Microbiology at the Faculty of Medicine, University of Malaya, and a consultant clinical microbiologist at the University of Malaya Medical Center. Welcome, Prof. How are you feeling today?
Hi, Charles. I'm fine. I feel well.
All right. So before we start off the session, talking about your experience with the vaccine and also debunk some common myths, we would like to do a bit of a survey with our live viewers today to find out who they are and perhaps what their opinions are towards the vaccine. So to our viewers, do go on to scan the QR code, or you can type slido.com onto your browser and type in the code 14972 to join in the live poll. So we'll start with the first question. Perhaps we'll give some time for people to go onto Slido and scan the QR code. Hmm. Okay, seems like the Slido is not working. All right, I think we have some technical difficulties with the Slido, so it's okay. We'll move on with the session straight away. So, all right, so Prof, before we talk about your vaccine experience, everything, could you perhaps give our viewers a brief overview of your role in the fight against the pandemic?
So along with the rest of my team, the clinical microbiology team at UMMC, I've been involved in COVID testing. So specifically, COVID PCR testing. So that basically involves me. When I'm on call, I have to, oversee the testing process, make sure that the COVID PCR results are interpreted accurately. That I have to verify them and make sure that whatever results that we get, that they are correlated with clinical histories of patients, because microbiological results cannot be interpreted without the clinical histories of patients. So that was one of my main roles. I was also involved in the implementation of the rapid COVID antigen testing in the ED and labor wards. So that has sort of helped as well with the management of COVID patients in those particular wards. Other members of my team, especially my MOs, have been actively involved in swabbing of patients and contact tracing activities. During the peak of the pandemic, we actually had two peaks, right? My team was also involved in helping with a national level COVID PCR testing. So we were also helping MOH to test cases from all over Malaysia, especially Sabah, because Sabah was hit particularly hard by the pandemic. So we were also involved in national level testing. Yeah, so
Right.
that's the gist of it.
Okay. So basically, it's a lot of testing and managing like
Yeah.
positive and negative cases. Okay, so
Mm.
perhaps can you tell us, because I believe usually people from the public, they'll see, oh, frontliner, then they'll have this image of a doctor wearing like T-Vac suit, working in the ICU, running around doing CPR, everything.
Mhm.
How is your role different from the doctors who working in the wards in
Mhm.
terms of the risk that you face and perhaps the challenges you face?
Yeah, so my job would be considered different in a way, because as a clinical microbiologist, I am involved in patient management, but not directly. So in terms of risk, I would say doctors who are working in certain specialties, so like microbiology, which is my field, infectious diseases, those working in A&E, ICU, those sort of doctors would be at slightly higher risk, I would say, of contracting COVID in their line of work compared to other doctors in other specialties. But with that being said, at UMMC, to be honest, throughout the pandemic, almost all doctors across all specialties actually had to contribute in some way, to the management of COVID patients, because it came to a stage where just too many cases, suspected cases especially, that everyone had to be involved, regardless whether you're, a rehab doctor and you never ever thought that you would have to, manage a patient with an infection. You're just thrown in to suddenly swab patients and do whatever that might not be what you usually do on a routine basis. So yeah, but maybe in other hospitals, yeah, certain doctors, especially those in my specialty, might be at slightly higher risk because of our risk of being exposed. We have a higher risk of being exposed to, either potentially infected patients or potentially infectious samples.
All right, understood. So, okay, so apparently the Slido is working right now. So we'll go over back there to actually have a look at our viewers who they are, so we can roughly, know what we want to talk about during the session. So based on the poll, right now we have about 22 responses. A majority of our viewers are in the age group of 21 to 40. We do have some who are younger than 20 and some who are between the age group of 41 and 60. All right. Okay. So the next one. Who are you? Are you a university student? Are you a member of the public or healthcare worker? Okay, the responses are coming in. We do have some member of the public with us. The majority of them are still university students. Okay, all right. So move on to the next one. Have you registered for your COVID-19 vaccine? Oh, we have a no. Okay. We have quite a few no's. Right, we have 26 responses and 24. Okay, we have more responses coming in. All right, since we have quite a large number of people who have not registered for the vaccine. Okay, all right. So to the 26% of you who did not register for vaccines, perhaps could you tell us why did you choose not to take the vaccine? We'll give maybe a few seconds for them to type in and then let's see what responses we'll get. Some doubts on side effects. Oh, someone said, I want to take the vaccine. Okay. Okay, so basically side effects. I scared because I'm scared. Could you perhaps tell us why are you scared of the vaccine? App issue. I want vaccine. App issue. I assume it's something with.
Oh, okay.
My parents are worried about it, although I'm a medical student that knows I should be vaccinated. I love vaccine. App issue. Underage. Oh, okay. We have an underage viewer who can't receive the vaccine. Okay. All right. Okay. So let us go back to our discussion. So we roughly talked about the overview of Prof. Nadia's role in the fight against the pandemic, and her role really largely revolves around lab testing, confirming the positive cases, doing PCR tests and antigen tests. So okay, we'll go next to the next topic, straight away into your vaccination experience. Could you tell us how did you feel before and also after taking the vaccine?
Yeah, so I had a discussion with some of my medical colleagues. The other doctors in my hospital. We were saying that it's good that if you could get a good night's sleep, mentally prepare for to get the vaccine. But to be honest, I couldn't do all that because I was actually on call for a whole week right up to Sunday, which was the day before I got my vaccine on Monday. So I couldn't sleep anyway. So, but I think even if I could sleep, I don't think I would have been able to, because I think of all the the excitement really of finally getting the first shot of my vaccine. So yeah, I think excited. I don't think there was any hesitancy from my part really. I wasn't nervous at all. I know some people would have been, even among doctors actually, but I personally didn't feel, I wasn't worried at all or nervous at all, just excited.
So
yeah, so that was before. Yeah.
After getting like the vaccines, could you perhaps tell us, did you experience any of the, the very common effects that people were always talking about? Did you experience anything out of the norm?
Yeah, so I mean, I did, experience some slight discomfort, some pain at the injection site, the upper, part of my left arm. But I mean, and also on the second day, the day after, I developed a slight fever. I was feeling a bit tired. I had a mild headache, but that resolved very quickly within a few hours. And those are actually very, very common symptoms of vaccination. Any vaccine would actually give you those symptoms. So I wasn't worried, and I expected that within a few hours I would be fine. So aside from those symptoms, yeah, I was completely fine. So today would be day 4. Day 4, is it? Yeah, day 4, because I got my vaccine on Monday. Yeah. So I'm completely fine.
So
yeah.
any of your colleagues, did they perhaps experience slightly severe effects, or was it everyone just getting, slightly a bit of muscle ache, a bit of fatigue, or like fever? Was it common, or did anyone did anyone experience something different?
Based on the discussions I had with my medical colleagues. I mean, the ones that got the vaccine on the same day. I would say majority got experienced very mild symptoms like me. I didn't hear from anyone who actually experienced more severe symptoms. Yeah.
So is it actually safe to say, like with all this typical common side effects, is it better to actually for us to term it as expected effects?
Yeah, for sure. And I mean, what I experienced, pain at the injection site, fever, fatigue, headache. They're not. We wouldn't refer to them as common symptoms. They're actually very common symptoms associated with taking a vaccine. So more than 1 out of 10 people will actually get this sort of symptoms. So expected, actually. Yeah.
Right. Okay, so moving on, could you tell us perhaps when? So you mentioned you received the vaccine on Monday, which was the first day of the rollout in Wilayah Persekutuan. Could you tell us where did you receive the vaccine, and perhaps what was the process of getting the vaccine?
Yeah, so I got my vaccine at the hospital that I work at. So that's Ministry of Malay Medical Center. So in terms of the process of it, because I'm a UMMC staff, I had to first fill in an online pre-vaccination survey form via the UMMC portal. So that survey basically contains questions like whether I have a history of severe allergies, whether I'm pregnant, whether I'm breastfeeding, things that might preclude me from getting the vaccine. So all very important questions that should be answered before you can be considered to be eligible for the vaccine. So after I filled in that form, I got a notification to say that I am eligible for the vaccine. So I was like, yay, Yahoo, I am eligible. So and after that, I had to fill out a consent form, also online, update my details, my name, my IC on the My Sejahtera app. And then on Friday, that was 3 days before my vaccine appointment, I got a call from the COVID vaccination team in UMMC, and they said that, I have to come in on Monday. So initially I was, slightly, I was a bit like, oh, wow, that's fast, okay, Monday. And I was also a bit concerned because on Monday, my vaccine appointment was at 11. They gave me an 11 o'clock slot. But I actually had to give a lecture to the stage 1 students from 10 to 11. So I was thinking, how in the world am I going to, give a lecture and then run for my vaccine, make sure that I'm there at the center by 10:30 because I have to be there actually 30 minutes before. So, I had to kind of work that out. And I felt very sorry for the stage 1 students because I had to cut my lecture very short because I said, oh, sorry guys, I have to go and get my vaccine. So, so I'm expecting maybe the feedback for that lecture will not be so good. Okay. Anyway, so I when I arrived at the vaccination center on Monday, everything was very systematic, very organized. Obviously I had to scan the My Sejahtera QR code, get my temp checked, get screened for COVID symptoms. Very important that they screen you first, just in case you happen to have COVID, right? So my screen obviously turned out negative, and then I had to give them my pre-vaccination survey form. I hand in my consent form, and then what else? Then I just waited to be called up to get the jab. Now the process of getting the jab, the shot itself, it only lasted less than 5 minutes, So obviously, I would say that, obviously there were people who took a bit longer because I think, not for me, but there were people who were like, taking photos, getting people to take photos of them, getting vaccinated. So I think the nurses who were administering the vaccine, they were very patient. They were like, okay, I'll take a photo for you and stuff like that. Because it was a very momentous occasion, to get the vaccine. So after that, after I got my jab, I had to scan a barcode with my Sejahtera app. So the My Sejahtera app captures and documents the details of the vaccine that you got, the type of vaccine, the batch number, the expiry date, all very important information. So that's all captured by the MySejahtera app. And then after that, I had to go on. I had to move to the recovery room. So because I don't have a history of severe allergies or anaphylaxis, I only had to complete a 15-minute observation period. So I was okay after 15 minutes. So I went to the counter, to the last counter, and they just gave me a vaccination card stating the type of vaccine I got and the date of my vaccine appointment for the second shot. And then lastly, before I could leave the recovery room, I had to scan another QR code. So there were a lot of scanning QR codes throughout the whole thing to download this post-vaccination pamphlet. So very important. So that pamphlet will tell you what sort of side effects you need to monitor for, what are the serious side effects that can happen after vaccination, and what you need to do and how to report those side effects. So the whole process from registering, being checked at various points, finally getting the jab, going through the observation period, that all actually took 2 hours. Yeah, so it took quite long actually. But the whole exercise, I would say, it was very well planned, very well organized, and I think I was very impressed with the fact that some of the volunteers were our own medical students. So I like to give a shout out to Yingxi, Judd. I think Judging was there as well. So I just would like to commend them for the great work that they did, and the other medical students as well who actually volunteered at the vaccination center. So it's amazing that you guys volunteered, and very grateful. Yeah.
Right. So as what you mentioned just now, before you guys, before the healthcare workers, the frontliners actually sign up for the vaccine, you guys have to fill up a pre-vaccine survey form. So you mentioned about whether the healthcare worker is breastfeeding or having any pregnancy. So to your knowledge, were there anyone who were actually being denied vaccination because they were pregnant, or were they given a choice to actually choose to take the vaccine even though they were pregnant?
Yeah. Okay. So if you are pregnant, you're breastfeeding, you actually can be considered for the vaccine. But again, you actually need to consult a medical specialist lah. So and the medical specialist will then assess your risks of getting the vaccine. So only if the benefits of getting the vaccine actually far outweighs the risks of taking the vaccine in that particular person who's pregnant or breastfeeding, only then will that patient, that individual will be allowed to get the vaccine. So it's a case to case thing really, so it's not a clear cut yes or no, if you are pregnant or breastfeeding, but you can be considered. And I think the Ministry of Health has also come up with that statement. I think initially they were very cautious, because I think they're definitely, because you see all the clinical trials that have been done on COVID vaccines so far have not included pregnant women and breastfeeding women. So, in a way, there's no data to sort of support, but based on current scientific knowledge, what we know, these vaccines, the current vaccines that we have, the approved ones, are safe to be used in women who are breastfeeding or who are pregnant.
Right. Understood. So basically they can choose to take it, but they have to understand, they have to sort of analyze whether the benefits outweigh the risk, and then they have to
but no, I mean not themselves. I mean the medical specialist who sees them has to evaluate all that and assess their risks.
Right. So you also mentioned that after taking the vaccine, you have to go into an observation room for a certain of time. So yours was 15 minutes. So let's say for those who have let's say maybe mild history of allergy, how different is their observation period?
Yeah, so I mean, if you have history of severe allergies, like anaphylaxis, and you were actually allowed to get the vaccine, and then get the vaccine, and then you move on to the recovery room. Your observation period will be 30 minutes. It will be longer than 15 minutes lah. So it'll just be extended by an extra 15 minutes just to make sure that you don't develop severe allergies. Yeah.
Right.
So that's the difference. Yeah.
Okay, understood. So you mentioned like you have experienced some expected effects of the vaccination. So you also mentioned like you before you left the vaccination center, you had to scan QR codes to sort of like inform you how to perhaps report if there are any adverse effects.
Yes.
So how is that done, or and did you perhaps report anything, like the symptoms that you were
Mm. Yeah.
experiencing?
So I think it's if you have gotten the vaccine, it's actually you are responsible. I mean, in the sense that if you have any symptoms at all, you should it's your duty really to report the symptoms. So you can use the My Sejahtera app. So that's what I did. You can go to that app to report what symptoms you develop after getting the vaccine. And I think you can also go to that vaccine COVID gov.my website as well to actually report any symptoms that you might have developed. So I think that's very important. Even if they're mild symptoms, it goes into the data. Yeah.
Right. So would you like describe the process as like pretty seamless? Like everything we can just use this app, and then you just have to keep on scan, and then eventually.
Yeah. So that's why I was actually, the entire exercise was very smooth in that sense, because a lot of details, information, that were captured, they were captured using my structure. Even things that we had to download information or whatever, that was also just by scanning a QR code. And you're also saving paper lah, in that sense, right? You're very, into environmental, saving the environment and stuff. It's also about saving paper. So
Hmm.
I think it's fantastic really that, you're using technology, in that way to kind of, make the whole process much smoother lah, the vaccine administration process. Yeah.
Right, understood. So moving on, you mentioned that before you received the vaccine, you were very excited already. So could you perhaps tell us how was the atmosphere among your team, or let's say your colleagues, when you all were informed that the vaccines are coming on Monday and you guys will be the one of the first to actually receive it? How was the atmosphere?
Um, like, because we the lecturers at the Faculty of Medicine, we have like a WhatsApp group. So there were like loads of messages in the WhatsApp group that I've been called, and I'm going to get my vaccine on Monday. And I think there were some people who thought that they were one of the very few ones, but there were quite a lot of us who are considered frontliners. So they were like a lot lah, a lot of messages like, oh, I'm excited, and going in. So obviously on Monday, there was this long queue, and you saw, it's nice because sometimes you're so busy that
Mhm.
you also don't get time to actually see your colleagues in other specialties. But in my queue at least, there was a consultant from gastroenterologist, consultant from geriatrics, and then there was also the ICU doctor just across from me who was post call like me. He was also on call with me for a whole week, and we were so busy, that whole week of being on call, of like, we were discussing cases. There were a lot of consults between the both of us, and and when I saw him, he saw me. I was like, oh, we are post call, but we are so excited to get this vaccine. But we were also very tired because we were post call, both of us. But yeah, there was a sense of excitement, a sense of jubilation. I think sense of relief. I think that's like a very apparent, sense of relief. And but again, the vaccine is one of the tools. It's not the tool that is going to get us out of this mess. We still have to wear masks, practice physical distancing. It's just one of the tools that we need to use to get this pandemic under control. Yeah.
Right. So could you tell us, working at the front lines, why did you decide to take the vaccine? And in the case, let's say, in a parallel universe where you are not working as a frontliner and you're not working in the healthcare, would you still have chosen to take the vaccine? And what would be your reason?
Yeah, I think as a doctor, especially working as a microbiologist, my risk of being exposed, to the virus and contracting COVID, is substantially higher than the general population. So deciding to take the vaccine, was a no-brainer. Really, it was a pretty easy decision, knowing that by taking the vaccine, I will not only protect myself but protect my family, my loved ones, especially my elderly relatives, my mother, my grandma. So I mean, I've been on the front lines of the pandemic for the past 14 months, and I think I've seen what this virus can do, and how it can affect people who are infected and their loved ones. And the second reason is I think this is important as a medical doctor. Looking at the data that has come out of the clinical trial so far, I'm convinced that the approved vaccines are effective and they are safe to be used. Okay. Now, if I, wasn't a doctor, I wasn't a frontliner, I'm, a member of the general public, I can understand, that, some people might be hesitant to take the vaccine, but I think again, because in this age of misinformation, there's a lot of, false information being spread around. I think it's important that if I'm a member of the general public, that I look for reliable sources of information, credible sources of information. If I want to know something about COVID or the vaccine, or actually anything that's health related, I should be going to a reliable source and not, from my auntie or my uncle, who, they'll just press forward, any messages that they get about COVID, and they could be lies, they are not factual, So if I do, I think it's the way health information is being communicated to to members of the public. So if I get the right information, for sure I would take the vaccine if I'm a member of the public. Yeah.
Right. So the message out there to everyone is to go and register for your vaccines and take it. So with the rollout, the implementation of the national COVID-19 immunization program, in your opinion, how will it actually change the pandemic situation in Malaysia? Because our current wave started way back in perhaps September and October, and it has lasted perhaps almost half a year, and we are just seeing the dip by a bit. So how would it actually change the
Yeah, I think the impact of the national COVID-19 immunization program on the pandemic situation in Malaysia, I think will depend on several factors really. The how effective the vaccines are in actually providing long-term protection and immunity, something that we do not know as of yet. And also how good the vaccine uptake will be. I'm sure all of you know that our government is targeting 80% of our population, to be vaccinated by February 2022. But I think the latest information, I think that has come out of MOH is that only 6% of Malaysians so far have registered for the vaccine. So, it's important that, lots of people get vaccinated, that we reach that at least at 80%. So because we need to reach herd immunity, for the vaccination program to be considered effective, that it's actually met its goal, So it's important that people register for the vaccine, get vaccinated. Okay, even if you are not in the high risk group, getting vaccinated will not only protect yourself, but it will protect others around you. Yeah.
Okay. So we'll move on to the next segment of this tea session, where we will try to debunk some common myths and also misunderstandings about the vaccination. So one of it, just now Prof is actually sort of mentioning. So a common myth, which I also heard quite a lot, is that if a person is young and healthy, you don't need to take the vaccine because mortality rate in Malaysia is just 0.4%. Prof, what's your thoughts about this one?
Yeah, I mean, of course, the overall mortality rate, might not seem so significant, but COVID can cause serious life-threatening complications. Okay, and even if you're not in the high-risk group, you're young, you're healthy, you don't have an underlying chronic condition, there's no way of knowing how COVID will affect you. I mean, there have been cases of young, healthy people who actually developed serious illness from COVID. I actually have a friend who's working in the UK. She's a doctor, and she contracted COVID from her patient. And she's young. She's my age. I mean, I'm young, right? Okay, and she's healthy. She doesn't have any underlying medical condition, but she developed serious illness from COVID. Actually, she was on MC for a long time. She couldn't practice. And she had to have an oxygen monitor in her apartment. So there's no way of knowing really how COVID is going to affect you. And you must remember, again, I think I've already mentioned this, that when you take the vaccine, it's not only about protecting yourself, it's about protecting others, okay? Because the likelihood that the vaccine will, prevent transmission, that is, obviously no one knows at the moment, but, based on current scientific knowledge, the vaccine may help to prevent transmission of the virus. It's what prevent spread, So you cannot think about yourself only. And remember, more people get vaccinated, okay, regardless old or young, you're going to help our country, reach herd immunity. So herd immunity is very important, so that we, the faster we reach herd immunity, the sooner we can all get out of this and go back to normal life. We want things to go back to normal. So the only way to do that is to be able, if once we reach herd immunity, we can do that.
Right. So you mentioned like especially for the youngsters, the younger generation to take the vaccine is to actually protect, not only to protect themselves but to also protect the vulnerable population. So there is actually this, I think, misconception among the vulnerable population, especially those with let's say diabetes and the severe the chronic diseases. They think that they should not get the vaccine because they are worried that their bodies might not be able to actually cope with it. So what's your your comment about this one?
So yeah, those who are immunocompromised, okay, especially severely immunocompromised, I mean, you can still be considered for the vaccine lah. So like cancer patients, if they are stable, they're in remission, they're not having active cancer, they're not undergoing active chemo, they can still be considered for the vaccine. But again, like pregnant women, breastfeeding women, it's important that you consult a medical specialist. It's a case by case sort of thing, so we cannot just have a blanket statement and say that you are in this group, you can't get the vaccine. So again, consult a medical specialist. But immunocompromised patients, for sure, they can be considered. Yeah, and they should be actually. If you're talking about very elderly people, I think there was a question, right, about the worry about people who are elderly and who are frail, who might not be able to cope with the vaccine. So yes, there have been concerns. There have been concerns raised by certain governments, especially in Europe, about the COVID vaccines, about the use of COVID vaccines, the efficacy and the safety of COVID vaccines in the elderly population, especially the AstraZeneca vaccine. So in countries like Germany and France, they actually restrict the use of the AstraZeneca vaccine in those under 65. So anyone 65 and above cannot get the AstraZeneca vaccine. But if you look at the latest data from that was conducted by Public Health England, which is a reputable organization in the UK, they actually found that the Pfizer and the AstraZeneca vaccines are highly effective and very safe to be used even in those who are above 80. So despite the age and frailty of this group of patients are over 80, the Pfizer and the AstraZeneca vaccines were shown to be very effective in reducing serious disease, reducing hospitalization in this group of patients. So, and I think because of that data coming from UK, I think countries like Germany and France, they might actually reverse their decision about the AstraZeneca vaccine. Yeah.
Right, understood. So another common misunderstanding is that the COVID-19 pandemic only started about a year ago, and then within a year we have the vaccines out, and we have several vaccines out. So people think that the vaccines are not safe and effective, and because they were developed too quickly and have perhaps bypassed many regulatory mechanisms. Is that true?
You know what? I totally agree that the COVID vaccines that we have now have been developed relatively quickly compared to other vaccines in the past. But but there are reasons for that. Because many countries in the world have invested tons of money into COVID vaccine research and development. So that's why pharmaceutical companies have been able to develop these vaccines very quickly. And then we also have to remember the mRNA technology, while a lot of people think is brand new, actually has the mRNA technology for vaccine use actually has been around for at least two decades actually. So scientists have had some experience using that technology in making vaccines. Okay, so it kind of explains why the COVID vaccine development has has gone quite fast in that sense. But and I understand why some people are worried about the safety of COVID vaccines, because it seems that the development has been accelerated in a way. The development of vaccines has been accelerated, but COVID vaccines, Pfizer, AstraZeneca, etc. They all have gone through the same testing process or steps like other vaccines in the past, and they've obviously gone through phase 3 clinical trials, which are studies that involve tens of thousands of people who volunteered to take the vaccine. And during this large studies or large clinical trials, doctors and scientists evaluate how well these vaccines work and how many people actually develop side effects from that particular vaccine that's been studied. And those findings from those clinical trials, if those clinical trials actually find that that particular vaccine is safe, it's effective, the findings from that particular trial will actually be independently reviewed by a panel of doctors and experts, who do not work for the pharmaceutical company. So that prevents bias. All right. So and then the panel of experts then actually come together, discuss, and they then make recommendations like whether that particular vaccine is safe and effective. And after that, there's another layer. Where countries, officials in individual countries actually, based on the recommendations from the panel, then decides if that particular vaccine can be used in their country. So like in Malaysia, the National Pharmaceutical Regulatory Agency, or NPRA, is doing that job for us. So there are many layers to it. So you cannot just put a vaccine out in the market without a vaccine being carefully evaluated, going through a phase 3 clinical trial, being the findings from the clinical trial being independently reviewed, and finally officials in individual countries deciding ultimately whether that vaccine is safe and effective to be used in their population. Yeah.
Right. So it's basically safe to say that the vaccines that are available right now has gone through a lot of tests by different people, so it's reliable to be used.
Yeah, and just to add that, because of the pandemic, so many people have been infected. So it was very easy for, the doctors and scientists involved in the clinical trials to recruit patients. You know what I mean? So that's why that also is a contributing factor to why the vaccines have, the vaccine development has been so fast in that sense.
Right. So we have questions coming in on both Facebook Live and Slido. So we'll go into one of them right now. This question is by one of our medical students, Raymond. So the context is there was this GP in KL who sort of like did a live video focusing on the side effects of the vaccines, and then it caused quite a big of a stir. And his question was, how can medical students actually play a role in addressing the misinformation that surrounds COVID-19 and also the vaccine?
Yeah. So, medical students, I think, as future doctors, you have a very important role in combating vaccine hesitancy. There are definitely a lot of people, especially in the general public, who, refuse to take the vaccine, and definitely it doesn't help when you have doctors like this particular private GP, who is the doctor but is spreading false info, about the disease and the vaccine. It doesn't help at all. So I think, what you can do as medical students to combat, vaccine hesitancy specifically is, I think you can start small, like, if you have friends, family members who, they tell you that, oh, I'm not too sure about the vaccine, I think the main thing is to first understand why they don't want to take the vaccine, identify their concerns first, and then after that, educate them about the benefits and risks of the vaccine. Sometimes one-to-one talk helps, and then try to dispel any misconceptions that they may have about taking the vaccine. And if you want to go big, you can do something like this, which is what you're doing right now, this tea session, right? So yeah, you can start small. You can do something at small level, or something big like this, where you can reach out to a wider audience and try to dispel misconceptions, not only about the vaccine but about the disease itself.
Yeah. All right, understood. Okay, so
I should also tell off your medical colleagues who are spreading false information. I do that all the time, actually. Yeah. So I either kick them out of the WhatsApp group that they're in, or yeah.
So basically, as medical students, we are sort of like we sort of have the privilege to learn this knowledge. So it is very important for us to actually spread it out.
For sure. Yeah.
Okay. So we'll move on to there's quite a lot of questions on Slido. So I'll share the Slido screen. This one is about allergy to NSAID groups. So Prof, just now you mentioned basically people who have allergy to let's say food or whatever, they will have to go through a slightly longer period of observation after getting the vaccines, right?
Okay, so if you have a history of severe allergic reactions, anaphylaxis, yes, for sure, your observation period will be extended from 15 to 30 minutes. Now, if you have, mild allergies like food allergies, that kind of stuff, again, it will depend on the vaccination team, the doctors in the vaccination team. They might say that, never mind, 15 minutes is fine. Okay, so again, it's a case-to-case sort of thing. But usually, like mild food allergies, it's okay. I think 15 minutes would be fine, actually. Yeah.
So this one, I think just now you already mentioned, basically for immunocompromised patients, they should consult with their healthcare provider. Is a case-by-case basis, is it?
Yeah. But the good thing is actually, it's not an outright no lah. You know what I mean? You can still register and then you'll be assessed. I think in certain countries it's an outright no actually, because they feel there isn't sufficient data at the moment to support the use of vaccines in immunocompromised patients. But again, that is depending on the country lah.
So this question from from an anonymous account, he or she is asking, what would you advise to a person who is actually hesitant to take the vaccine?
I would advise that person to watch this tea session. and I think this tea session will change your mind. No, I mean, on a serious note, again, like what I had just mentioned, as medical students, doctors, I think the main thing is to first understand why they don't want to take the vaccine first. Okay, why is it that they don't want to take the vaccine? And it's only then can you actually educate that person, dispel any misconceptions. If you don't understand their concerns, then it's not going to give a positive outcome lah. Basically, you're not going to be able to convince that person to take the vaccine. Yeah.
Right. So basically it goes back to the concept of empathy for us to actually understand why they don't.
Yeah, understand first. Yeah, and don't be critical. I have had friends, who have called me the past week. They know that the vaccine rollout, is happening at the moment. I've got calls from them and asking me that, I really don't think it's safe for me to take the vaccine. So I go through those steps of, trying to understand first. Don't be judgmental, because the minute you say, what's wrong with you? You're so educated. Some of them are not doctors, but they're educated. They're engineers, they're lawyers, but they are hesitant to take the vaccine. So don't be critical. Like once you are judgmental, that's it. They'll be like, I'm going to talk to someone else. And then the other person they talk to is going to be someone who's an anti-vaxxer. So that's not going to help your case.
Right. So basically we can say like every concern of theirs is considered a valid concern, and then we should try to work with them.
Yeah. I mean, it's valid in their eyes, So you have to understand that So yeah, they might have had a really bad experience with a vaccine in the past, or a particular medication. So it's understanding why they don't want to take the vaccine. That's important. Yeah.
So moving on, we have this question. I believe it's from a medical student. He or she is asking, would you be possible for you to direct us to some journals regarding the effectiveness of the vaccine?
Mhm. Yeah, so I think journals like the Lancet, okay, the Lancet journal, has a lot of very good articles, reporting the findings of clinical trials, COVID vaccines. There's actually a good one on the Sputnik vaccine from Russia. I think a lot of people have doubts about the Sputnik vaccine. But if you look at, you just have to go and Google Lancet Sputnik, and you'll find that article. It actually, gives very concrete evidence actually that the Sputnik vaccine actually works. So you can go to the Lancet. They have a lot of articles reporting data from clinical trials, COVID vaccine clinical trials. Yeah, of course other journals as well. But Lancet being Lancet, I think you would be a little bit more confident maybe of what they report, I guess, or what they publish. Yeah.
Mhm. Right. So you mentioned about the Sputnik vaccine. So I think the next question is sort of related to it. So what is your opinion on the various types of vaccines in the market? And
Mm.
according to the info available, there's like differences, the efficacies.
Mm. Yeah, I mean, it's expected that you would see that all these different vaccine types will have different levels of efficacy. But I think the main thing first is to understand what vaccine efficacy means. Okay, so for example, take the Pfizer vaccine. Okay, the Pfizer vaccine has a 95% efficacy in preventing symptomatic COVID infection. Okay, so what does that mean? So if I were to ask, someone relatively educated, and I did the past week, they gave me the wrong answer. They actually do not understand what 95% vaccine efficacy means, and I don't blame them because of how vaccine efficacy has been reported in the media. It can be quite confusing. So when you say that a vaccine has 95% efficacy, it doesn't mean that 5% of people who were vaccinated with that vaccine actually will get COVID disease. It doesn't mean that. Actually, 95% vaccine efficacy means that if you get that vaccine, your chances of getting symptomatic infection, for example, if that's the outcome that's measured in the clinical trial, is reduced. Your risk is reduced by 95% compared to if you didn't get the vaccine. So it's important that that we understand that, okay, and because there's a lot of people are misinterpreting that vaccine efficacy value. Okay, so now again, yes, the vaccine efficacy levels differ across different types of vaccines, and it's understood because of the fact that different clinical trials are conducted differently. Different people are being studied, their underlying risk factors for the disease may be different, and where and when the clinical trial was conducted also can influence the vaccine efficacy that's reported. So if I were to use a good example, like Johnson and Johnson, the vaccine produced by Johnson and Johnson. Okay, so that pharmaceutical company conducted clinical trials in 3 separate locations. So the US, Latin America, and South Africa. So the findings from that Johnson and Johnson vaccine clinical trial was that they found that the overall efficacy of the Johnson and Johnson vaccine is actually lower than the vaccine efficacy in the US alone. Okay, so that finding, a lot of experts feel that the reason why they found that particular finding in those 3 clinical trials is that the clinical trial that was conducted in South Africa, the clinical trial of the Johnson and Johnson vaccine that was conducted in South Africa, actually took place after the emergence of the B.1.5 I can't even remember 351 or 651 variant. Okay, so it took place after that variant emerged in South Africa. So that might have influenced the vaccine efficacy. Okay, but that doesn't mean though that the Johnson and Johnson vaccine doesn't work in South Africa. They still found a vaccine efficacy level of, I think, 64%. So 64% vaccine efficacy is actually good, because it's basically saying that if you get that vaccine, your chances of becoming of getting symptomatic COVID infection or COVID disease is reduced by 64%. So that's a lot, compared to if you're not vaccinated. So you got to interpret that vaccine efficacy value very carefully, and also to make sure that that the vaccine the vaccines used are efficacious. WHO actually has set a minimum efficacy level of 50% for a COVID vaccine. So it has to meet a minimum of 50% efficacy. Anything lower than that, then it cannot be put out in the market. Yeah.
Right. Okay, I think because we're running a bit short of time, so we'll perhaps take one last question. So I think we can sort of talk about this one. So according to like the latest reports, we have a new variant coming up from the UK. We have coming up from South Africa as well. So are there actually vaccines that are being developed to combat the new variants, or like perhaps the current vaccines are sufficient to combat against the variant?
Yeah, so that's a very good question. So, again, the knowledge, regarding SARS-CoV-2, the vaccines against them, it's still evolving, all right? But most experts, believe that most of the COVID vaccines that have been approved will offer some form of protection against variants that have emerged. Okay, and the reason is because COVID vaccines actually trigger a fairly, how would I put it, a fairly broad immune response. So a couple of mutations in the virus will not really, affect the effectiveness of COVID vaccines. But again, with that being said, yes, there are studies being conducted at the moment to assess the effect of variants, on the effectiveness of the current COVID vaccines that are out there. But the good thing is that even if those studies find that some or all of these variants actually are not effective or not very effective, okay, the vaccines are not very effective against these variants, scientists can actually easily develop modified vaccines that will work against these variants, because all they have to do is just actually alter the composition of the antigens in the vaccine. So it's not something that is going to be difficult to do, really. Yeah, but they have to work quickly, So yeah.
All right. So before we wrap this session up, can you give like perhaps your final advice to our viewers who are perhaps both students and also to the public?
Okay, so everyone, especially if you're a Malaysian citizen, non-citizen, please register for the vaccine. It's very important that we meet that 80% target, 80% of our population receiving the vaccine by February 2022. We have to try our best as a nation to reach herd immunity. It's not only about health, it's also about we have to remember that we have to also restart our economy. There are many people who have lost jobs, during the pandemic. So we must remember it's not a health issue as well. It's an economic issue as well. And yes, for those who will eventually get fully vaccinated, get the 2 doses. If you're getting the Pfizer vaccine, please make sure that you still wear a mask in public, practice physical distancing, and wash your hands often. Just think of the vaccine as an extra layer of protection. Okay, so it's very important that you don't forget that. The vaccine shouldn't give you a false sense of security, so that's very important. And yeah, to the medical students out there, you have a very important role to play. And I think this tea session that you're doing, with me, I think will hopefully, be something that will help change the minds of people who maybe before watching this were hesitant or refused to take the vaccine. So I think you all have a very important role to play as future doctors to combat vaccine hesitancy.
Right. Thank you so much for that advice. Okay. So to wrap up, thank you so much to Associate Prof. Nadia for sharing your valuable experience with us tonight on T session #vaccinated. It is of our greatest hope that more people will actually go and sign up for the vaccine and at the same time fight the infodemic of false news surrounding the vaccine. We all should understand that it is our duty to take the vaccine to protect ourselves and the people around us and also the future of Malaysia. Hopefully, with the rollout of the vaccines nationwide, this will perhaps be our first step towards returning to normalcy. If you have any comments for this session or you would wish to see more similar sessions being organized, do fill out the simple feedback form provided on the screen later or in the comment section on Facebook Live. Don't forget to register for your vaccines. This is the T session #vaccinated with Associate Professor Nadia, brought to you by MEDSOC COVID-19 Task Force. My name is Gerald. Thank you, everyone, and good night.
Goodbye. Good night, everyone.